I am testifying today in opposition of House Bill 1216 because if enacted, it would create another layer of confusion and government regulations on top of an industry who is already overregulated by 4 federal agencies, which account for 629 regulatory requirements that health systems, hospitals, and post-acute care providers must comply with, including state-level survey, certification, and oversight. Visiting restrictions have existed since the first hospitals were established in the early 1800s and have been used not only with the aim of reducing the spread of disease, but also to protect patients and family from stress. Healthcare providers who accept Medicare and Medicaid payments must comply with these regulations or risk non-payment of services, and some may even lose their license to serve this population. As you know, and as you've heard, and as you've lived through, in March of 2020, COVID completely changed our world, and no other industry was hit harder than the healthcare industry, especially those provider types listed in this bill. The COVID-19 pandemic exposed several vulnerabilities in our systems of care, and many lessons were learned, especially, like was mentioned, the psychological damage of the lockdowns and social isolation on both staff and patients. Visitation guidance from CMS was constantly changing during the public health emergency. And a reminder, we're still in the public health emergency until May. In March of 2021, CMS updated its visitation guidance for nursing homes to allow for compassionate care visits. That was in March of 2021. Nursing home visitation was once again revised on November 12th of 2021, stating that visitation was now allowed for all residents at all times, and non-compliance would result in citations and enforcement actions against the provider. The most recent visitation guidance was updated just last year, September 23, updating the guidance regarding the PPE and vaccination status. So in all healthcare settings, we rely on our clinical professionals to make the best decisions for the health and safety of our patients and residents. And in South Dakota, we work together to solve problems. We had great collaboration throughout the pandemic with our state and all of our healthcare providers. So we don't need to add more government regulations to solve these problems.
It's not uncommon for us pre-pandemic to have 40 to 50 visitors in our building. Back again now, once all the restrictions have been lifted, that family interaction is key, and that has been restored. I've been in Webster for the last 7 years and saw firsthand the effects of the pandemic. One thing that we all hope that we never have to work through the course of our career is working through a pandemic. It's difficult to see the effects on patients, on residents, on staff, and families. Going back to March of 2020, CMS did make the difficult decision to limit visitations within our facilities due to the high mortality rate for our elderly population. During this period of time, facilities did start daily and weekly communication plans with families to go through the changes and the issues that were going on. We pivoted to FaceTime calls, Skype calls, and other means of communication with families. As the weather did warm up, we were able to go to outside visitation and then back into indoor visitation along with compassionate caregivers visits. Long-term care is already the second highest regulated industry in the United States, only behind nuclear power plants. The major concern that we have is that additional regulations may at some point conflict with federal law and regulations that are already in place. This did happen in other states, and facilities were forced to make the decision on what would be the least harmful to the organization. The current CMS QSO, which is 2939NH, states a nursing facility must allow in-person visitation with applicable CMS regulations. The CMS regulation is 42 CFR 48310F4. And that states that a resident has the right to choose his or her visitors and will be held accountable to that regulation. And we are surveyed on that by the Department of Health, by the Ombudsman Program, and by CMS. For this reason, I do urge you to oppose House Bill 1216.
In May of 2020, I had the honor of being selected to serve as one of 25 people on Vice President Mike Pence's Coronavirus Commission on Safety and Quality in Nursing Homes. This opportunity was a great stage to shape policy for the better. CMS Secretary Verma, Health and Human Service Secretary Azar, and CDC Director Dr. Redfield listened in during every commission meeting, and many times we saw policy direction implemented almost in real time in news cycles a day or two following. You may ask, what's this have to do with House Bill 1216? Well, one of the things the commission was debating and advocating for, this bill is advocating for the same thing. The commission met 1 to 2 times a week from the end of June until the 1st of August. We delivered a report that highlighted 9 themes and 27 principal recommendations. One of the themes, and I would say the one with taking up the most time and energy, was on visitation. We reported that although visitation restrictions partially protected physical health, it resulted in unintended harm, loneliness, anxiety, and depression. Our directed action was to provide updated guidance on in-person visitation to adjust protocols and safely increase in-person visitation. As you heard from other presenters, CMS did implement those recommendations, and shortly thereafter, the visitation restrictions that we've all heard horror stories of were lifted. Admittedly, there were some bad players throughout the industry that continued to very restrictive policies. Those doing so, however, were doing so out of compliance with federal and state guidance, and were in fact subject to corrective action. I would just add one comment off of unprepared comments. If this bill hypothetically were enacted or in place during that time in 2020, nothing would have changed because we were following the federal guidelines as required under our license through CMS. I oppose 1216 not because of its principle, but because 1216 is not needed and only creates more bureaucracy and red tape for facilities without benefiting the patient or their families and friends.
I am testifying today in opposition of House Bill 1216. Our South Dakota assisted living communities are abiding by the current rules regarding visitation. We currently have infection control and education policies for staff and visitors and have been audited during the pandemic by the state regarding our infection control practices. Overall, many of the visitation rights listed in this legislation are already covered in state and federal laws and guidelines. We are allowing visitation to the greatest extent possible as deemed safe according to CDC, CMS, and state guidelines. To pass this bill would be a redundancy for assisted living providers. The pandemic, which for now, for the most part, is past us, has been a challenge for everyone. And adding additional regulations would place burden on the assisted living centers who are already working as hard as they can to keep residents, families, and staff members safe.